Topic under discussion today is from the ACS, one of the ACS, that is STEMI. We'll talk about the STEMI. What is STEMI? ST elevated myocardial infarction or ST elevation myocardial infarction. We'll discuss in detail. We'll talk about the definition, how to define what's pathophys of the STEMI, what's clinical presentation of the STEMI, what is diagnosis of the STEMI, management of the STEMI. We'll talk about all. And remember, we have already discussed STEMI and unstable angina in our last lecture. You can check that out. Okay, if you want to study that or learn that. Coming to the point, STEMI. What is STEMI? Very simple. ST elevated myocardial infarction. How to define it? Myocardial ischemia that results in transmural myocardial injury is termed as STEMI. Due to myocardial ischemia, if the result is transmural myocardial injury, that is called as STEMI. Got? Very simple. So very important point is transmural myocardial injury. If there is transmural myocardial injury because of ischemia, that is actually STEMI. Otherwise, that is unstable angina or NSTEMI. Okay, very simple. Coming to the pathophys, here we'll discuss how transmural myocardial injury is caused because of the ischemia. Very simple. The myocardial that is supplied with the blood vessels, coronary arteries, there is a plaque formed. That plaque in the STEMI is ruptured, and this rupture results into thrombus formation, and that leads to occlusion of the coronary arteries. When this coronary artery is occluded, stopped, means the blood supply is reduced, what will happen? Then the tissues available here, the myocytes, like transmural myocardial. So if this blood vessel is the one that is supplied to the myocardial, and that is transmurally ischemic, then means if there is ischemia transmurally, so then what will happen? This myocyte will damage, which will be injured, due to which what will happen? Very simple, a heart attack will happen, and that is named as STEMI. So what we got from here, if there is decreased supply of the oxygen, means if there is ischemia, myocardial ischemia, how? Like transmurally. If there is transmural myocardial ischemia, that is actually called as STEMI. Okay, this is actually damaging the heart myocytes. Cardiac myocytes are damaged because of insufficient blood supply to the particular myocyte. Very simple, summing up our discussion in one line. What happened in the pathophys? Here actually the plaque was ruptured, and that occluded the entire blood vessel. So complete occlusion took place, due to which the particular myocardial injured. We call that as transmural myocardial injury. So if transmural myocardial injury is seen because of ischemia, that is known as STEMI, ST elevation myocardial infarction, ST elevated myocardial infarction. I hope it's clear now. Now, what is the clinical presentation? In all, they are same, but in some cases, like in the STEMI, it is of a little bit more severe type. Chest pain of severe type will be there, and breathlessness again, location of the pain. We cannot pinpoint, but we can tell, we can observe that this is actually from the epigastric to the jaw and retrosternal. So this is the entire region that can be covered and observed in the STEMI patients. And duration is more than 30 minutes, okay? Now, some of the points here you are seeing, and you may observe while you are listening and watching my lecture, those points are actually of the previous lectures. Don't confuse yourself. Just listen and concentrate what I'm speaking, where I am pointing, okay? Just focus that. Now let's come towards the next point, that is diagnosis. So we are done with the definition, pathophys, clinical presentation. Now it is time to discuss diagnosis. Regarding diagnosis point of view, we will check the history of the patient. We'll ask the signs and symptoms. We go for the history entire. Then we will go for the ECG. Regarding ECG, we know about there is P wave, there is QRS complex, and there is T wave. So yeah, somehow. Anyways, coming from the starting point, so if there is S and T segment, this segment if elevates, if there is elevation of the ST segment, that is actually indicating that the person is having attack that is named as ST elevated myocardial infarction. So this is the point that is telling us about the STEMI in the ECG. Then we will go for the echo. In that, we will check the shape, size of the heart and its capacity. We'll check the ejection fraction. Then we'll go for the biomarkers, specifically troponin, T and I. There are certain other biochemical also available, biomarkers available. Okay. Remember, we have certain other biomarkers available, like CK, LDH, and etc. etc. The very important is actually troponin, T and I. Now, what is the reason behind this importance? Very simple. Because of the uptake, sometimes we get different types of the ECG, and some other results are not actually accurate. And this biomarker is actually telling us the accurate. Then it is somehow leading us towards accuracy. Now, what happens when there is injury of the myocardial? Okay, there are the release of the troponins, like these biomarkers, troponin T and I. So what happens between 12 to 24 hours? Now this is the duration. Within this duration, this troponin T and I actually peaks, and then this troponin T and I remains in the blood for about 7 to 10 days. So that's why if the patient is late submitted, if the patient is lately submitted to the hospital, or is brought to the hospital, or is lately admitted to the hospital, so in all these cases, actually this can give us the very perfect and accurate result. So that's how biomarkers is helping us to diagnose the STEMI. Now, regarding management point of view, we'll have following drugs. Now, before going to the drugs, you might be knowing about the drugs and the mechanism of actions. I'm just giving you guys a short concept that all these drugs are what are they doing to us, to the patients, to treat them and to make us understand about the treatment and management. Very simple. We can observe our targets from this particular blood vessel. What is happening here? There is a increase in the lipid in the body. Along with that, there is the narrowing of the blood vessels, and there is pain being observed, and there is insufficiency of oxygen, and there is clot formation, thrombus formation. So these all are actually our targets. So here we have the drugs that are going to help us target these points and reduce the pain feelings, painful sensations, and somehow other factors are actually alleviated, and we are actually treating the STEMI. So starting from the very first, we have thrombolytics, streptokinase, alteplase, and oxygen. As we mentioned, now we're mentioning the drugs that are coming here. So oxygen is supplied, nitroglycerin, directing the blood vessels, morphine for the pain, and ECG is supposed to be monitored while going through all these. Then we're giving aspirin, 300 mg. It is actually acting just like what antiplatelet. If you have remembered the antiplatelet cascade pathway, we have discussed antiplatelet pharmacology. Anyways, if you are feeling confusion here, just search the particular point with my name, with our lectures name, with our channel's name. You will get that entire topic available. So we actually explained all these topics in our previous videos, their mechanism of action. So if you don't know the mechanism of any here, please search with our name the mechanism of certain topic, like check aspirin by Dr. UUT, you will get the lecture. Anyhow, coming to the next. So like this, we'll give clopidogrel, again antiplatelet. We'll give CYP2, B3A, like abiciximab, and some other prasugrels, etc. Again antiplatelet. So warfarin, anticoagulant, beta blockers, calcium channel blockers for the contraction of the heart, reducing the heart load, and potassium sparing, magnesium, ACE inhibitors, and stool softeners. These are all used in the management, and they're actually used in this sequence. Okay. After that, if we don't see any sort of some sort of that we need a kind of being improvement in the patient, if we don't observe that, so then what we do is we shift the patient towards revascularization